Like I said, I have passion for preventive care and chronic care management because I think those are the two most important things we can do for ourselves. You know, life happens, so that diseases get thrown our way. The only thing we can do as people is to take good preventive health measures. And also, once we get into the realm of having chronic health diseases, we have to manage them very well. And the third and the most important thing for me as an African is for us to know our health history, because that's one thing lacking in our society. We don't know our health history. And what do I mean by that? You don't know the conditions that killed our relatives. It's very typical to ask an African, do you if they have any chronic diseases in their family, and they don't know, which is sad, but that's the truth. Back home, when somebody dies for one reason or the other, we never share what actually killed them. And so, and that's our biggest problem, in my opinion, as Africans, because I mean, regardless of the disease, be it diabetes, hypertension, a cancer, the earlier you know about it, the better your prognosis or the outcomes. So if we don't know we have diabetes, usually by the time you hear you or you've been diagnosed, it's pretty far gone. If you don't know there is a colon cancer in your family, by the time you're told you have that diagnosis, you're probably in the large stage. So I think it's very, very important we have that conversation with our family members. Let's go back as far as we can to know what killed our people. Because once we know, then we know what we're dealing with as humans. Then preventive comes in. You know, we have diabetes in our family, then you'll be low on the sugar. You be very careful how much sugar you absorb as an individual. If you know you have high blood pressure in your family, chances are hopefully you buy a blood pressure measuring cuff. And then you'll be checking yourself. So then you are ahead of the game. Because especially with stroke, when it happens to you when you're in your prime age, 40s, it usually kills you because then you don't know what is going on. So you're far gone, which is always the biggest problem that I have observed among us. So I think it's very important to take, we know what we are dealing with as individuals, because knowing that it's already half the battle. Once you know you have a particular disease, chances are you will take preventive measures. And that's where preventive health comes in. It becomes very important for us to do that and make sure we take care of ourselves. And then when finally we've been told, hey, you are hypertensive, meaning your blood pressure is high, then we have to manage those conditions very well, which is as simple as taking our medications every day. If they told you, hey, you have some kind of a glaucoma, eye disease, it's important we buy medicines and put the drops in our eye, because some conditions, once it's out of hand, it's out of hand. When you have an eye problem which is not being managed properly, when you cross the line, when you go into blindness, that's the end of it. There's nothing anybody can do to help you. So when we have a chronic condition going on, it's important we take care of those and manage them very well. So those are the things which I'm really passionate about, and I hope we teach ourselves and be comfortable knowing what is going on with us and how to deal with them. And like Jeff mentioned, since starting the Delwood, I have been a recipient of the grant for free flu shots. I know most of we grew up without this flu shot. We came here when we were older, so we haven't really had it as long as people who were born and bred here. And it's very typical for us to say, hey, I have never had a flu shot before, which is fine, but there's always a first time. And I think this year with COVID going around, it's very important we get that. Why? Because it has the flu virus and the COVID virus, they have similar symptoms when they get presented. And what we can do as individuals now as part of our preventive care is to make sure we don't find ourselves where there will be other COVID patients. You don't want to get the flu and find yourself in the ER or an urgent care where you could possibly be sharing a space with a COVID patient. So it's very important we take care of that and get the flu shots. Yes, it has some unpleasant effects a day or two after being, you have some tenderness here and there, but I can assure everybody on this call that the flu shot is a dead virus. It does not cause the flu. So please, at least you could have other kinds of reactions to it, like a headache, or usually it's pain at the site of injection, which is the most common. Your arm will be numb for a few days or so, but that's about it. It takes 2 weeks to take effect. So if you get a flu shot and you get the flu, chances are it's not from that virus. First of all, it's a dead virus, so there's no way it can cause the flu. So I know we're all concerned about that, and so we should at least take that preventive measure. And most places now have it for free, so you don't have to pay for it. And also, talking about the preventive healthcare too, I know some people have lost their jobs and things, so they can't really afford their medications now. If you find yourself in that position, there are resources out there. You know, with the COVID came several grants, so there are several resources around us. We just have to find them, because what is being done is the they're trying to take care of underlying conditions. So there are grants all around to help people with underlying conditions like the diabetes, the hypertension, the cancer treatments, and other things going on. Because once those conditions are well taken care of, if God forbid you find yourself exposed to the COVID, chances are you're not going to succumb to it. Chances are you're not going to be very sick and find yourself in the hospitals. So please, let's try and take good care of ourselves. And then, because now we can't really isolate ourselves forever, we cannot stay in our homes forever. People have gone back to work, children are going back to school. So we have to learn to manage this pandemic as we have it going on, listen to the sciences and do the best we can. So this is what I have for you all this evening. And if you have any questions for me, I'll be more than happy to answer them as the night move along. Thank you.
Thank you so much, Rebecca. That was very, very helpful, at least to hear from you and from your experience. And I hear that you're reminding us, most importantly, to know, find out our home history, our family history, what killed our grandma and great grandpa, what are the common issues that our relatives may be going through that may be a part of us. You're reminding us to know what we eat and know how we keep our body healthy. You're reminding us to know it is important to know the disease. It's always very good if you know and discover whatever the disease you have, so you can be able to manage better than just not knowing what you might be a carrier or you might be seeking of anything, but of some diseases. But if you have not been able to been diagnosed, then you might be able to discover it when it's too late. So having those preventive cares is checkup is always very helpful, so that at least you're able to manage. I'm told that diabetics is something that you can always manage if you were able to diagnose it early, and including cancers. Cancer is something can be well treated, and if it's diagnosed very early. So I really appreciate that. So I will open up if somebody has a question before we go to the next speaker. I can give like one or two questions for somebody can ask related to what Rebecca had just shared or anything to do with the services that she provide. And you can just unmute yourself if you have a question. I think as we continue, you can always put your question on the chat. There's a chat over there. You can always put your question, and I'm sure we're going to be able to respond as time goes by. We're going to go to the next speaker, and the next speaker will be Kevin. Kevin Gomez is a community engagement coordinator at Casa de Salud, a community health clinic in St. Louis, Missouri that focuses on serving immigrants and refugees. Before joining Casa, Kevin lived in Malawi, Southern Africa for 3 years, working for a women health clinic. Kevin is from St. Louis, Missouri, and comes from an immigrant family himself. He's passionate about serving this community and is grateful to be with you all tonight. I actually didn't know about you being able to been to Africa for those 3 years. That makes you an African, really. If you've been there for 3 years in Malawi, you're an African by default now. So, and I know Casa de Salud has been a great partner for us for many years, and especially for even mental health and just regular health. But I will let Kevin to continue from there. Kevin, go ahead.
Thank you, Jeffrey. Thank you for the invitation to be able to speak to your community. It's such a privilege. As you mentioned, I am from St. Louis, from an immigrant family. Casa de Salud has been an important institution that has served my community, and my mission being at Casa is to continue to expand our gates and reach out to different immigrant communities, and that's what we've been doing since the last 2 years. So Casa de Salud is a Spanish word for house of health. It is a community clinic, and just like how Rebecca was talking about preventive care and chronic care management, that is mainly what we focus on. Many of the things she was saying are so important and so true. And we see a lot of patients at our clinic that are diabetic and that have other chronic conditions. In addition to that, we see a lot of women. So we have around 4 gynecologists at our clinic that offer wellness exams and other gynecological exams for women. So that's something that we're offering. We do also have a few other specialties like psychiatry and dermatology, but where we focus most of our energy is with primary care and with gynecology. In addition to our clinic, we have a health case management team. We have 5 staff members that work with our patients whenever there are procedures or specialties that we don't have in our clinic. We have our case managers confirm appointments at regional hospitals. So that's an important program because, healthcare can be complicated just in general in the States, especially if you're underinsured or uninsured, which are very sensitive to patients that fit those categories of being uninsured and underinsured. With the patients that we serve, the immigrant population, we are very sensitive and intentional about serving those patients because these are the ones that are falling through the cracks. So accessing healthcare is complicated, it's expensive. Our job is just to try to make it easier, to try to simplify things and to try to use the connections that we have established over the course of the last 10 years that we've been in existence, using those connections to the network that we have, the medical network that we have here to serve immigrants and refugees in St. Louis. So yeah, our case managers work to confirm appointments at other hospitals. Pre-COVID, we were accompanying our patients to their appointments. Right now, that's on pause until further notice. And also, as I was mentioning, healthcare can be expensive. So at many of the hospitals, the big hospitals here in St. Louis, there are financial assistance programs. And in order to access that, it's an application that you need to go onto their websites, submit a bunch of paperwork, tax forms, income, many different forms. Our team members are here to help the community to fill out those forms, submit them to the hospitals, and hopefully get either percentage discounts, get discounts from healthcare, up to like completely free care. So we're happy to help with that. You don't need to be a patient at Casa de Salud to access our case management services. Also within that is education. So our case managers have been trained to educate patients with patients at Casa de Salud, and also just community members in general. If you give us a call, we have case managers that are there to help educate the community in St. Louis. Before I wrap up the GIA, the case management department section, I want to go back to what I was saying about the clinic. I was saying we had gynecology and primary care as our main areas of focus. We also do diabetes education and nutrition. We have nurses that assist with that. So if there are, if there's anyone out there that has family members or then yourselves wanting to access that sort of information or clinic, we're happy to get you in. We're growing that program currently. Currently, I've had discussions with about 4 additional nurses that are going to be joining us and providing nutrition classes and diabetes education classes through Zoom. So because of COVID, we had to develop this new way of delivering healthcare services through Zoom. So that definitely helps with the barrier of transportation, and we're able to see even more patients now. So with all of our medical care, we offer telehealth as well. So that's something that I wanted to mention as well. If you're unable to make it into the clinic, we can confirm an appointment with you through Zoom as well. Lastly, Jeffrey was saying something about our mental health program. 2 years ago, we opened the Mental Health Collaborative, which is a building right next door to our clinic. We are close to St. Louis University. We fundraised and opened that building, the Mental Health Collaborative, because we were seeing that uninsured and underinsured immigrants and refugees in St. Louis were waiting up to a year to access mental health care. So someone that has the need to speak to a counselor or therapist cannot wait a year to access this sort of service. That's ridiculous. So we spoke to funders and with St. Louis University, and we opened up this new program. So now we have 27 counselors and therapists that are here to provide counseling and therapy to the community of St. Louis, which is a great achievement because not only for immigrants and refugees is accessing mental health care complicated, it is a system that is just generally hard to navigate. So even American citizens with insurance have trouble accessing that. So we've created a system where if you call us, within 3 weeks, you will be speaking to a counselor or therapist. That's also another program that has been growing because of the pandemic. It has fast forwarded our our telehealth systems. It's pushed us to develop telehealth really rapidly, and with that, it's allowed us to grow even more and to offer therapy and counseling to the community. So that's all I'll say about Casa de Salud. I will be linking in the chat some additional information and phone numbers if you or anyone in your community is interested in. We're happy to serve everyone, especially the immigrants and refugees in St. Louis. Thank you.
Great. Thank you so much, Kevin. I think that's really, really helpful to know, and especially when we have a lot of people who think that you need to have, you can't be able to see a doctor because you don't have insurance, or maybe you don't have the proper documentation that most of the healthcare facility or institution will ask for. But Casa de Salud is able to fill up that gap. And you've been, how long has Casa de Salud been in business?
10 years.
10 years, yes, awesome. And what's the average number of patients you see in a year?
Per month, before COVID was around 400, and now we're around 250 per month with COVID.
That's a lot of people. That's a lot of people. And I would say that a lot of African community, I'll encourage them to take advantage of these resources. And now with the mental health, which is a big issue and a big concern in our community, we actually trying to encourage people to discuss this issue of mental health openly. Be open, be able to feel free to discuss and encourage people also to seek help, especially if you identify some things that you are not normal, that you would feel like this person needs some attention. And it's okay to seek help. It's not a weakness to seek help when you feel like you're not really feeling okay. So we would recommend people to speak up openly, and also provide this one. You don't need to have insurance. Just call. I think I will be able to share that number on the forum for those through the same forum that I invited people.
Okay, Jeffrey, I'm sorry, I wanted to include pricing details.
Yes.
So each visit to the doctor is $35. You don't need insurance. We don't take insurance, actually. So each visit is $35, and to speak to our case managers, that's free. I encourage the community to use our case managers. We have built relationships with doctors' offices and different clinics and different hospitals to help bring in community members and connect them to specialty care at other places. That's a 10-year relationship, and we've become quite good at finding low costs and quality doctors that are able to provide those services. The mental health care, that's an agreement between the client and the therapist. It's on a sliding scale from $0 to $20 per session. So we don't tell the therapist what to charge. They can, we tell them that they can only charge no more than $20 per session, and it can go down to $0 depending on the need. Yes, the $35 clinic charge that I mentioned, we will never prevent anyone from accessing healthcare. If the need is great, we are willing to make arrangements, but we will never send anyone to collections or be aggressive with their charging.
Great, thank you so much. And I think, like I said, those are great resources that our community needs, and the pricing that is affordable for most of the patients. So anybody who has a questions, you can always unmute yourself and ask Kevin before we go to the next speaker. or if you have a chat, is there somebody who has a question in the chat? Yeah, if you have a question, you can always throw it on the chat. But I think something that I may want to ask Kevin is that most of the people, when they hear about Casa de Salud, they think it's only the name is only appealing for the Hispanic community. But I think I've seen a lot of outreach that you've done connecting to different community, immigrant community as a whole. Do you have an input on that?
Sure. Yeah, that's a great question. The origin story of Casa was intentional about serving the Hispanic community in St. Louis because 10 years ago, it was the biggest number of immigrants that were coming to St. Louis. That's interesting. I wonder if in the future, Casa de Salud's name will change to be more attractive to other communities that don't speak Spanish. We don't intentionally only serve Hispanic people. We provide interpreters for any language free of charge in our appointments. So any language that anyone speaks around the world, we cover that. So that enables us to see patients from anywhere. And yeah, we're getting better at it. I would say we are, part of my job is reaching out to the different communities as you mentioned, having partnerships with the International Institute, for example. Right now we're seeing more and more Nepalese refugees in St. Louis. We're also seeing them in our clinic. So we are trying to be intentional about spreading the word out and saying we're not only for Spanish speaking people. But yes, sorry about the name, is just in Spanish, but we see everybody. Good.
Yeah, it's good to know that. Yeah, I know I have worked with Jorge when he was the president, and now the new president, Diego, is also a great friend that I've worked with him for a long time from International Institute. Your team is great. I want to say that we appreciate the great work that your team has been doing to provide health access to those underserved population. I think we will move on to the next speaker, and I will go ahead. Is Coco, you there? Coco?
Hi. Yes, I'm here. Sorry,
okay.
It took me a while to find the button. Yes, I'm still here.
That is good. That is good. I know you are I wanted to transition to you because you have a great what comments shared about interpreters working with different interpreters, and I know All Access is one of them. Do you mind sharing a little bit about what All Access does before we invite Ciro?
Yes, and I apologize for I'm in the car, so I'm trying to.
That is right. That's
yes. Hi everybody. Thank you, Jeff. I work with All Access Interpreters. We provide interpreting services in the St. Louis area. We work, I like to work more close with a lot of the organizations that help immigrants. I think it's been a lot of information today so far. And I think we can all agree that language access has always been a challenge for our communities. Mm-hmm. I was recently at the hospital, unfortunately, and it was a ride. It was a ride. As a patient, I can only imagine the hard time that the community will have just navigating to be a couple days at the hospital. Mm-hmm. So language access is always a big help for the community. So we're here to help. We're here to help. I can share our number in the chat. So if if you have any needs, we can always help the community. We're open to help. I always like to find new partnerships, and I'm here to help. That's all I can say. Any way that we can help. We currently have 53 languages here in Cienloes. I might be a little bit off, but I think sometimes it goes up or down on those numbers. I mean, I was very surprised to find out how many different languages are spoken here in Cienloes. Well, we have them. I'm not going to say we have them all, because I know that there's a couple of languages like Grebo that is a little bit hard to find. But if we cannot find them on site, we can always cover them online via VRI or over the phone. Over the phone, we have 153 languages that we can offer. So either way, we're here to help one way or the other. And now with COVID, we all have to agree that VRI and phone interpreters have been more successful to help with preventive care. And also, when they have to go to the hospital now, I've noticed a lot of more visits to the hospitals due to COVID. So we change and we adapt so we can offer a better service and safe service to our clients and partners.
Thank you so much, Coco. Oh, that was really, really helpful. I know the great work that All Access has been doing, and especially reaching out to the smallest community. I know sometimes I hear you asking, do you know somebody who can speak this language? I don't know, some of this language I've never heard about them. But it tells me how committed you are to make sure that you're able to reach every person who needs your help. And I think you've done a great job to connect also with the different service providers, so that they are able to provide the necessary service and care that the patient may be in need of, so that a language will not be a challenge or a problem to limit them from accessing some of those services. So
exactly. And the longer they take in a doctor's or at the hospital, that's more money that sometimes the patient has to pay out of pocket. So language access is always helps to cut down that amount of time for a. Sometimes a lot of the times they can't help the patient because they can't just communicate with them. So we're here to help. And one more thing, always looking for interpreters. We train them. We have our training facility at All Access Interpreters. Of course, it's been a challenge due to COVID, but as I said, we're being changing, evolving. So we're ready to launch also some training online. So if any of you know about somebody that will be good and would like to work as an interpreter, we would like to hear from them. As I said, we train them.
Great. That will be awesome. So I'm gonna, I think I have your number here. I'm gonna post it. But let me just put it here. What number do you think they should call for those who are interested in that?
314 259 1010.
259 1010. Okay. I'm gonna share it out. There's somebody who may want to call All Access, and they can hook up. I know people. I know there are people who may be interested to do that job of interpreters.
Yes. Thank you so much. Thank you, everybody.
Thank you so much for that, and thank you for your great partnership. All right, All Access. I'm gonna say Access Interpreters. Okay, so thank you so much, Coco. The next person to The next speaker will be a great man that I know. I've always had him every time we invite him. He has always been able to provide himself, avail himself to share a little bit of what he's doing. I think he's one man I really admire because of his great determination and focus in whatever he commit to do. I've known Ciro for quite a number of years. I think when we were starting B4A, he's one of the people that I was consulting, and he has been a great partner, even speaking for us and being an ambassador for B4A in so many areas. So Ciro Lom serves as the Executive Director of Caring Ministry, Inc., which serves low-income families, immigrants, and refugees in becoming self-sufficient and finding sustainable housing in St. Louis area. He also teaches at St. Louis University as adjunct professor. Lom immigrated to the United States at the age of 7. He has earned a degree in political science, communications from the University of Missouri, St. Louis. He also holds a master's degree in legal studies. In his free time, he serves the most recent refugee immigrants in connecting them with necessary resources to become vital aspect of St. Louis. At the same time, he enjoys working alongside young immigrants men in developing their skills to become successful in today's society. And I've seen him even on Sunday, I've seen him playing some nice gospel music with young people and mentoring young people. Always proud of you, Ciro. Go ahead.
Thank you, Mr. Jeffrey. Appreciate it. It's an honor to always speak in this platform. Thank you for doing this. It's a great thing that you're doing for the immigrant community, for the African community. Appreciate it. So yes, so Caring Ministries, it's a local nonprofit in St. Louis, and we're here to definitely help immigrants, refugees, low-income individuals, get them stability in St. Louis. And we feel as though one of those main sectors is through housing. So we provide with immigrants, refugees with affordable housing. You can literally get into your own home by just paying $1,000 down into your home, which is amazing. It's ideal. And then another platform. Most of us are used to, if you're an immigrant, you're used to building your own house, right? But if you're a low-income individual, you can't afford to customize your house. So we give you the platform in which you're able to actually come in and customize your own house. We outsource it. We don't do it in-house, but Caring Ministries outsource to various construction companies that provides the renovation. You get a handpick, the approved family, the immigrant, refugee, or low-income individual gets to handpick how they want their home done. If it's not just color painting, open floor plans, wood flooring, tile flooring. If you want to add, add addition to the house, whatever you want to look like, you can customize your own home according to the budget that you've been approved. So we work with various individuals, as Nintendo for Africa and others, but our main goal once you come in is to connect you to get credit approved, because we believe that in credit, you're able to acquire home ownership. But because we believe home ownership is one of the most important things, the law, when it was written for people that own land. So those same laws are still in place, right? So we believe we move you towards home ownership, but to get you there, one of the sustainability mechanisms is being credit sound, right? And we partner with Justin Peterson. I know BFL, Better Family Life, does a little bit of it. And also we have Prosperity Connection that does some of that. So we partner with them. You get approved. We have various banks that we work with, but we're not saying that we have a deal with the banks, right? We don't have a deal with the banks. We want you to choose whatever bank you want. You can choose, and we'll work with them. But we do have certain banks that we've worked together to create a certain portfolio for an immigrant or refugee to have that kind of $1,000 down payment, $1,000 down that's only needed to move into their home. Once they're approved, we start house shopping. And house shopping looks like we ideally want to also help the city of St. Louis. Be presenting soon of how immigrants and refugees help revive a city. And I'm a fully believer in that. And we'll soon be doing that. But we try to say, do you want to live in South City, North City, somewhere that's you have more distressed properties. We don't force you to live in those areas, but we encourage that because we believe that we can lift the community together. But if not, it's okay. You tell us the zip code. We identify that zip code. We search for the features, 3-4 bedrooms that you're looking for. We have your budget price, and we go in there and we want to renovate it to you. Once the renovation's done, it's your property. We don't own the land at all. You don't have to live there for 8 years, 5 years. Some companies do that. We can sell you the house the next day. You can turn around and you can sell it. It's yours, right? But it's tailored towards you, your family. So we don't want you to do that. But if you choose to do that, that's up to you. We want to give you and make sure that you have equity, right? Usually we try to give you at least $10,000 or $15,000 equity in your home. So we know hard times happen. We know things might happen. So, hey, you're moving, you turn around, sell your homes. We're not trying to destroy a neighborhood. So they're within those comps at the same time. But hey, I have to sell my home. Okay, I'm selling my home, but I'm having equity in it. I'm making money off of it. And we assist you with mortgage assistance, first month of mortgage assistance. Why do we do that? We really want every individual to become a homeowner. So when we're giving you that 1 month mortgage assistance, it's not for you to go blow your money, because you would have paid it if you were renting or whatever you were doing with it. But it's to teach you the good stewardship of saving your money and making sure you save. So in case a rainy day happens, something like COVID happened, people lost their jobs. But if we save you, we teach you those principles. We don't want you to put you in a situation in a home that's a big time investment, one of the biggest investments you can make. We want to make sure that you're successful in that home. We want to make sure that home appeases you. And we don't try to we encourage you not to use the max that you've been approved for, but something that you're comfortable with, that you feel like it's good. But that's the process. We sell you the home. It is yours. It's usually appraised at a higher value, and it's simple and it's cutthroat. And so that's what Caring Ministries does. We're always eager to help any individuals that walk through the doors. We're going through a rebranding, and it's going to be released soon. I'm pretty excited about what that looks like. Recently, I took a new role that would limit my time at Caring Ministries. Still will be serving as executive, still will be able to do what I do in these conversations, but it'll just be second tier to what I do full time at WashU. So we're really excited about what Caring Ministries look like. We want it to be a place that, you know what, even if you just want to buy a house in the open market, we want to be there for you. We want to be the hub for every immigrant and refugee that's searching for a home. We want to be there for you because I went through it, and the others on the team that are going to be joining the team went through it. We're all immigrants, and we know we endured the pain, the struggles, the ideology of moving towards homeownership and becoming sustainable. So that's what I have. I hope you guys have questions. A very simple process. We're eager, excited to help anybody. If for nothing, come find out how we can connect you to credit counseling, other things. But most importantly, we do want you in the housing, and in partnership with like Vintendo for Africa. Last time they sent us a wonderful lady that was able to get a house. Great, amazing. She was able to close on her house. I know she had a loss of a family member, but these are the opportunities. Through connections, through networking, we will get our families exactly what they need, which is sustainability, because we're all fighting for that for the families we serve.
Wonderful, 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 Cyril. I love that energy. I love that. That is awesome. And that information is very, very helpful, especially for our African community who actually may be struggling to get the right information. And we've had people make very wrong choices, and it put them in a very deep situation that takes time to come out. So when we have great resources like Caring Ministry and people getting into the fast track, the right track on investment, asset building. So it's something that I know I'm really passionate about it, and I can see the passion you have about it, knowing that you're touching many lives in a small way or in a big way just by giving them the right information. What you may want to share the number that they need to call for the Caring Ministry.
Okay.
What is that?
I can write it in the chat, but I'll say it, then I'll write it in the chat. It's area code 314.
Okay.
764 5415.
76. Just go ahead and write it on the chat.
Okay.
Okay. Then that is good. Anybody have, I think this time I'm gonna open up for questions. People wanna ask questions about the program that Caring Ministry and the services they provide. If you have a question, you can always throw it up. I think we are just about 8 minutes away. That's wonderful. Any questions or any question from the previous speakers? I will let you go ahead and ask a question. And I think as we get people to raise up questions, I may want to ask Cyril, do you work with people who are very new, or do you also work with people who have been here for years? How do that work? Because some people may think it's only that your service is only for the people who are very new, and I may be here for a while. I messed up my credit, or I let my house go away for some times, and now I'm trying to get my life back. Can I work with you?
So yeah, completely. And that's a great question, Mr. Jeffrey. That's really a great question. So we work with everybody. Regularly, if you just arrive, it's going to take some time to get into a house. If you have unfortunate reasons, have a bad credit, it's going to take some time. But yes, we work with everybody. If you've been here longer, we work with you. If you've been here 5 years, 10 years, 15 years, some people have been here 15 years and still don't have a house. We still work with you. When you just arrive, we work very closely with the International Institute, have that agreement in regards of they're informed about caring ministries and house ownership. So while you have the matching funds, saving funds, and International Institute, you also sent over to caring ministries, and we work with you in preparing you to purchase your house. So through that process, we can send you to Justin Peterson and others and wait for you to get ready, because you could be ready technically to buy a home. After 3 years, you should have 3-year taxes set, and then you should be ready to buy a home. But yeah, we want to work with anybody from inception, coming into the country, to being here 15 years, credit. If you're an immigrant, you fit the model. You fit our business and what we're trying to do, because once again, we believe that immigrants really help St. Louis, and we just want to be an arm of St. Louis providing affordable housing to immigrants, refugees, and low-income families.
Great. That's a good one. That's a good answer, and good to know that everybody is welcome to tap of the resources you guys provide. And that includes, you mentioned something good to know, that if you don't have good credit, I know you mentioned Prosperity Connections. We had one of the staff talk to us 2 weeks ago. You mentioned Justin Peterson, which also does a very good job in those who want to repair their credit, but they want to build their credit, repair or build their credit. Those are great programs that we would recommend people to reach out to in case you need some help on that area. And you also mentioned that you are able to customize. So I can buy a house that is foreclosed, and then we can work out how you can customize on what I need to put on the sink, what I need to put on the color, the doors, the kitchen, the stuff, how you want to modify. I think that's a great thing and most of us want a complete basement where you can have your grandma and grandpa to stay. I think that's a great resource that I would recommend people to make use of, especially if you want to get a house that you're gonna build some equity in it. And I think that's what you mentioned, that you really want to make sure that people are able to build some equity in their houses. Any other questions? If you have some questions, I will I got 3 minutes. I will open up any questions from the previous speakers. You can always ask a question.
Well, I just want to add to.
Yeah, go ahead, Rebecca.
Okay, so like I said, I got a grant for the flu shot, and I also got a grant, which is part of the CARES grant from St. Louis County Health Organization for prescription help. So from listening to the previous speakers, we are working with immigrants, and then people are helping them see doctors and other caregivers. So I think we can actually work together. My grant for prescription help covers co-pays or payments people make out of pocket. And so if you are below the poverty level, or you just press hard, you've lost your job, you're unemployed, or you were diagnosed with the COVID, those are all part of the criteria that I can use the grant for to help you pay for your prescription medication. It doesn't have to be a very expensive out-of-pocket payment. If you have to choose between buying gas, $10 in your car, or picking up a prescription, then there is a need. And this grant can help cover that. So my number is 314-868-3333. If you find people who are in need for such help, please pass this information along to them. They can call me and I can come alongside and work with that. So with the gentleman from the Casar, yes. Once you see your patients, I don't know what services you have when it comes to their medications. I think we can work together using this grant to help some of the people who may be covered under this grant. And I really, this is the first time I'm in business, and this is the first time I got a grant, and I hope to be able to use it. It's not a very huge grant, but I want to be able to use it and also demonstrate there's a need out there. So come next year, if there is a similar grant, we can get it and use it to help the people in our community. So I just want to pass that along, that we have those resources that we can use. The paperwork with us, it's a little bit less, it's a little bit straightforward, versus going to the bigger hospitals who also have similar grants to use. And we deliver. So once we fill the prescriptions, you can deliver to their residence or workplace. All right. Thank you, guys.
Thank you so much, Rebecca. I agree with you. This is a great opportunity for us to show the need in our community. And like you said, the free flu shot is available at your Delwood pharmacy. People can always call and make appointment. I think you gave out the number. People can always call and make appointment. And I think the best that we can do is actually to make sure that we utilize that grant so that it can open up opportunity for us in the future. And I know that your success is actually the success of the community. That means when you're successful, then you have more resources, more services to provide our community. And that's all we need. That's all we want. So we want to pray that you succeed. We want to pray for Cyril to succeed, Casa de Salud to be a big organization and well-established with great resources so that our community can be able to access the resources that they need. So thank you so much, Rebecca. Anybody else who have something want to add, or even the speakers? If not, I just want to mention that there is election that is coming up next week. If you can be able to do your early absentee voting, you can still do it at Northwest Plaza. I had shared the early information. There's a line, if you go early, the better. If not, just make sure you vote on Tuesday next week and research on your candidates that you're voting, but also on some of those amendments that are happening within your own localities. I encourage people to just educate yourself on what's happening around. We will continue to do these forums just to educate and create more awareness in our community on different topics. The next topic is on holistic health. We have an immigrant who is a holistic doctor here in St. Louis. He will be talking to us on Thursday next week. I think it's Thursday on November the 5th at 6 p.m. same time. So you will be able to see your communications, but just mark on your calendar and invite your friends. It's in family. It's the same thing that everybody is talking about, Rebecca, Kevin, and Ciro and Coco, about how do you keep yourself healthy? Do we just wait until you're sick? Then you can be able to go to the hospital? or do you take your care of yourself so that you can be able to prevent some of those diseases from coming to your body, attacking your body? And I think we always reminded that you eat and live. Eat like food is I mean, eat like food is medicine, or you'll eat medicine like it's food. So take care of yourself, eat healthy, do a lot of exercise, do a lot of spiritual meditations, and make sure at least you're able to have a good rest. Those are the rest is, they say rest is your best medicine. And I think that's the most important thing that I can be able to put. We have a group, we have quite a number of groups that are teamed up to be able to do health. If you want to team up with a group that does walking, there is a group that does walking and exercise at Rifco. They meet on Saturdays at 8 a.m. If you're interested, we can join the group. We have a biking club that does biking, but now we have really closed because of the weather. We've been meeting on Saturdays also at 8 in the morning. There is a group that does golf. If you're interested in playing golf, I can connect you with the team that does golf. And there is also a group that does basketball. Anywhere you can hook it up. The only thing I will not connect you is a group that likes sleeping and and eating all the junk. That one I will not be part of that. But stay healthy and encourage your family members also to eat healthy, and but also be informed on some of the preventive care, preventive resources that are available. If anybody who has something or information that they want to pass out before I close the meeting.
Jeff, I just want to say thank you so much for doing this, and I just want to say hi and bye to everybody.
Thank you so much, Coco, and thank you for being with us.
All right, everybody has a good night.
Thank you so much, everybody. Thank you, Ciro. Thank you, Kevin. Thank you, Rebecca, and all those who logged in tonight. We appreciate you. We are happy to have you. And we hope that the information that was shared, you'll be able to go out and share with others. Thank you, Catherine. Thank you, Faiza, Gladys, John, Jane, Anthony. We appreciate you for being with us, and Mary, Rose, Willie, thank you for being with us tonight. We will meet again next week on Thursday at 6 p.m. and we will have a holistic doctor who will be able to share information on that. All right, thanks you and enjoy the rest of the week. Go and vote.